Hello, everyone. I hope you all are doing well, and it's good to be with you again. Chaplain Nato asked me to do something on palliative care, and I'm assuming that you do have some palliative care there where you live, as well as some hospice care at this time of history there in the Philippines. So I'm going to begin about palliative care. What is it? It's interesting because it comes from a Latin word meaning, Latin word spelled palliar, and I will spell that for you. Palliare, a Latin root word, palliar, and it means to cloak. Cloak. The word's origins provide clues about the role of palliative care. It's a way you can imagine it is to imagine literally a layer of a coat or a cloak or I'm trying to think of the word that covers you and offers warmth, protection, comfort. And so as it came about in medical care, palliative care, wanted to provide a way of extra support alongside the physicians and medical team. So, in the hospital that I work at, we have my hospital is Unity Point Health Trinity, and we have both home health care nurses. We have palliative care that's in the hospital, the clinics, and at home. We also have hospice care. So, just for your information, I don't know what it's like there, but it is an extra support level of care. Another way to identify it is I've got a little spiritual care note that we pass out in our hospital. We have a lot of spiritual care notes on different things, different topics. And I grabbed one today and it said, in one sense, all healthcare is palliative because the verb to palliate means to soothe without curing. It means to comfort, to alleviate, or at least lessen, minimize someone's pain and suffering. So, whenever a person is sick, whether it's an acute disease or because of a long-term disability or maybe the illnesses of the elder, palliative care efforts do help to comfort, soothe, and care for the whole person. Traditionally, doctors, nurses, and all other healthcare professionals try to cure, cure patients of their ailments, while at the same time they focus on the patient's comfort and basic care. But I think in med school and from the beginning of history, when there were doctors being trained, it was to try to cure someone or at least treat them, hoping that the cure would happen. But as we know, for some cancers and other diseases, there is not an absolute cure. Some diseases can go into remission, but there is, of course, the divine healing that cures someone from God. But palliative care is a really wonderful, I think it's a blessing from God when hospitals can have this, or clinics or wherever you are, um, seeking some extra besides the basic medicine, medical care. So when you have a good nurse, if you've ever been hospitalized or you have someone that comes to your home or you work in a clinic, sometimes the bedside manners of nurses, even more so than doctors, it seems, not to sound negative about doctors, but bedside manners make a difference because the person feels loved and cared for truly, genuinely, and it just does something to their spirits. And so we often refer to nurses sometimes, you're an angel. That thank you so much. I know I've experienced that when I've been in the hospital. And even in the hospital there in Baguio, I had some wonderful nurses. And we get to see Filipino nurses and physical therapists and lab people here in my hospital a lot, and they are truly a blessing, by the way. So, you know, it should be that we should try to help people be as pain free as possible and as comfortable as possible. And so sometimes it's impossible to take away all pain, but we can help for a person not to have unnecessary pain or cope with have help in coping with treatable burdens that come along with illness. So what exactly is palliative care? It is palliative medicine, or they call them here palliative care specialist. Everything these days are specialist. Focus less on curing a patient's underlying disease and more on caring for the patient as a whole person: physical, mental, emotional, spiritual, relational, um, the whole person. We are integrated as human beings, and one thing affects the other part of our wholeness. Um, so the goal is to lessen pain levels, to try to lessen stress and worry and other concerns that get in the way of potential healing. So that is so important in everything we do, especially as chaplains. Let's see. Also, if a patient is facing a lengthy course of treatment or recuperation from an accident, surgery, or cancer, uh, terminal cancer, then the palliative care specialist or team can help coordinate long term plans to help that patient and families deal with some of the stress and burden from having a long-term course of illness. So it also, the palliative care nurse or specialist, as I've said before, assists the patient in coping and having hope and focusing on getting well, especially if it has not been diagnosed as terminal. Um, Pain management is a primary part of palliative care's therapeutic efforts. So we do know that, and some people, when palliative care first became popular, maybe, I don't know, 20 years ago here in the States, I'm guessing that. But people were confused about hospice care and palliative care, and is it the same? And I want to stop right here and just say no. Palliative care refers to relieving the symptoms of an incurable medical condition. So trying to ease and relieve some symptoms, trying to ease the stress and improving overall quality of life for the patient and the family. But hospice, hospice care is end of life care. So hospice is, just like it said, end of life. So the person is in the dying process at some level. And so the hospice nurse, social worker, respiratory therapist, the different people involved in hospice, their main goal or mission is to keep the patient comfortable in the dying process and provide support, emotional, spiritual support to the patient, to the family. So there is a difference. If a person goes into palliative care, then it doesn't mean that they are dying. It might mean that they have some very serious health issues or disease process, but it does not mean that they are terminal or they're in some phase of the dying process. And so this list from the Cleveland Clinic in Ohio, the state of Ohio here in the United States, where this article came from, that Chaplain Nato sent me, I thought it was interesting to read this list of various health conditions, medical conditions that may need or benefit from palliative care. That is the ALS disease, which is the neuro uh, uh, degenerative disease that is not curable, and people, it is fatal. It's called amyotrophic lateral sclerosis, or short ALS. You may be familiar with it there. Alzheimer's disease, cancer, COVID, severe cases of COVID-19, even those that are not getting any better. Chronic obstructive pulmonary disease, COPD, which I think I remember that you have quite a bit of that there in the Philippines. Heart disease, HIV and AIDS, kidney disease, liver disease, lung disease, MS, or multiple sclerosis, Parkinson's disease, which is a neurological disease under the umbrella of uh, memory and degenerative brain disease, and stroke. Some strokes are more serious than others, and some strokes leave people in very debilitated conditions that they don't recover from, if at all, taking a long time to recover. So palliative care teams include medical providers, doctors, physicians, and other specialists who can help you manage symptoms. They can also help you navigate added stress that comes with that, and responsibilities that often accompany illness. And so here in the States at the Cleveland Clinic, it's a huge hospital that people from all over the world come to. It's one of our one of our largest hospitals in the States. But the palliative care team could include a doctor, nurses, social workers, even dietitians or nutritionalists, spiritual advisors or chaplains, financial advisors to help a person plan for the future. So, those are some things that may help you sort of get a better frame of reference for palliative care. And also, I don't know about there in the Philippines, but here in the States, palliative care can be provided in a person's home setting. We have assisted living facilities here, nursing homes, hospitals, of course, and even some outpatient clinics. So, anyway, those are some of the things that I wanted you to be able to learn, and also just to know that palliative care specialists have been trained not only medically but also in these other areas that we're talking about. And so, but back to the physical symptoms, I just wanted to give you a little small list of some things that they can help manage pain and manage symptoms. So, some of those that come with illnesses, different types of illnesses I've named, are nausea, fatigue, pain, trouble sleeping, lack of appetite, shortness of breath, stress, GI, gastrointestinal problems. And so, some of the ways that the palliative team that I've worked with in the hospital where I'm a chaplain, they even do things like tips for improving sleep, cognitive exercises for neurodegenerative illnesses like Alzheimer's and Lewy body's disease and Parkinson's. They're really good with relaxation exercises, breathing, nutrition guidance, exercise guidance, talk therapy. Does that sound familiar? Listening to people talk about how hard it is to go through a severe acute illness or terminal illness. Healing touch and meditation, prayer, even some do massage. So, those are some of the special ways that palliative care really do help the whole person. And I think that there's ongoing education that's needed. And once again, I don't want to sound like a broken record, but I'm not familiar with what is there where you are, or even in bigger places like Manila. But I'm sure that people need to keep understanding palliative care, and the people that you are relating to need to understand that and how it can help weigh treatment options, helping them make their best decision and coming up with different options, just like we do in counseling. We help the counselee to discover different options that they want, that they can take or they can work on, or that are possible to bring hope. So, palliative care is very good with that. And of course, all of us, um, we know that the more informed we are, the more we can make good care decisions with our family, and with our values, with our goals, our preferences, and our faith. So, the palliative care specialists are supposed to be able to help us, help patients communicate that to the medical providers. And of course, social networks are very important, and also for caregivers that are under a tremendous amount of stress with someone with a terminal illness or a long term illness or rehabilitation, a recuperation from surgery. All of those things, the caregivers really undergo a lot of stress and a need for care as well. And let me see if there's anything else before I go. Um, I just want you all to know that many people can act in the role of like a palliative caregiver because if you have compassion, care, time, to spend with someone who is facing these kind of illnesses and need the compassion and care and loving support. Family, friends, other people can be that. But when you are a chaplain, you have a role and an identity and authority from God to really care for that whole person in their time of need. So just want to emphasize that. And let me see if I've left out anything else. Is there palliative care beyond medications? Because I do want to emphasize that pain medicines are used a lot in palliative care. And so, like morphine, once morphine was starting to be used more and more back, I don't know, 20 years ago, morphine can lower respiration rates and heart rates. So, someone who is like a week or two away from actually dying, then it lowers their blood pressure, it lowers their breathing rate and their heart rate. So, some people would say, you know, do I really want to use some of these analgesics for pain? But I think that palliative care people, when they're talking with families and the patient, if they have, say, bone cancer, which is a very painful cancer, then if they're terminal, then to you have the, I guess, the decision to say, is it more important to ease their pain, which is very severe pain, knowing that they're going to die, that, you know, is it better to give those medicines or not give? So sometimes there's some moral, ethic decision making that goes on and with the pain management part of palliative care. And that is something that the patient, if they're able to talk about, and the family members, the caregivers, they can talk openly and out loud about that if there's some issues that they have. Um, but just like with hospice nurses, they come and monitor and assess the pain level. And so many times that is their sole mission for a hospice nurse or a hospice doctor. So, but the palliative care, it's a little bit more open ended, but they do want to minimize or alleviate as much pain as possible. And so, is there palliative care beyond medication? And there certainly is. Um, because the human person is an amazingly complex creation, physically, mentally, spiritually, and socially. So we can use things like prayer and meditation, music, um, breathing exercises, mindfulness techniques, and humor. and positive thinking. One of the pioneer authors and doctors, he was an MD, Bernie Siegel, Siegel. You can look him up. He wrote a lot about love and healing and laughter and how that is healing. So, in addition to medicines, there are some things that palliative care specialists can teach us and teach us as chaplains as well. So I think that is about it. It's been probably over 20 minutes. And the big question is, when is it time for palliative care? And there isn't a certain time. It's if you have it available, it can start anytime. Now, I know here there's a lot of different medical insurances that would help pay for that. So I don't know how that would work where you live, but check it out and find out what's available, what does it cost. But meanwhile, make yourself available as a chaplain in some of these ways. And Chaplain Nato can give you the link that he gave me. It's just a very short couple of pages of documents. And I have tried to summarize that along with our palliative care spiritual care note that we have in the hospital that we use sometimes or give to patients or family members. Here in the States, I will end with this. Here in the States, usually, almost always, a physician, doctor, will make a referral for palliative care to come and do a consult with the patient or go to the home. So it is right now it is a physician's order or order for consult referral. So check it out there and see what it is. So anyway, I've enjoyed talking about this. It's near to my heart. My mother and my mother-in-law were both on hospice when they were dying of Alzheimer's, but I see it used all around me and how beneficial it is. So I hope it can be useful there where you are. And to all of you, stay well spiritually, mentally, emotionally, physically, and God bless each and every one of you. Bye. Until next time.